One of the most effective and yet underutilized therapies for painful conditions, injuries, and surgeries is physical therapy. In an era where powerful pain medications seem to be the standard, driven to our country's worst substance abuse epidemic, many inside and outside healthcare look for safe and effective answers. Physical therapy is an answer that's been there for decades, helping patients recover after surgical procedures. More and more research is showing the benefits of PT on many painful conditions, including joint surgeries, periods of immobility, degenerative conditions, and injuries, whether acute or chronic. Not only can physical therapy improve recovery, it can decrease future injuries, pain, and setbacks. At Court Physical Therapy, they work with patients throughout their recovery to maximize functional wellness and decrease pain. One of their biggest businesses is the in-home physical therapy, which they call Outreach Program. This service is designed to evaluate the home and assist in the early recovery phases after joint replacements and complex surgeries. Whitney DeWeese is the coordinator for the Court Outreach Program.
I've been a physical therapist for over 5.5 years, and the past September 2015, we started an outreach program, which is really geared towards patients who are just not quite ready to get into the outpatient clinic. Those patients may be knee replacements, hip replacements, overall just joint replacements. We also have patients who may be at fall risk, which need a little bit of finesse in their gait and their ambulation and how they walk.
There are basically 3 phases of physical therapy for recovery from surgical procedures. This is the hospital setting, the home setting, and finally the outpatient clinic setting. The earliest phase is in the hospital, right after surgery, helping the patient in the immediate postoperative period. After discharge, the physical therapy moves to the home, as the patient needs to continue that recovery, but is not to the point that they can easily and practically make it into the outpatient therapy clinic setting. Rob Swayze is a physical therapist and the coordinator for one of Court's outpatient clinics. He explains why it's important for them to be involved early and throughout the recovery phases.
So if you have surgery, say for a total knee, total hip, especially a total knee, there's a certain amount of time where you can only get a range of motion. And if we don't get it within a certain amount of time, you will get a stiff knee. I like to call it the wet cement phase. Every day that goes by, the cement gets a little bit drier, harder to get. So our role is to make sure that they're on track to get that motion as quickly as possible.
The home setting is an important consideration for the therapist because it's where the patient will spend most of their time and will present many of the challenges and potential setbacks the patient will experience.
I really think with joint replacements specifically, patients have so many questions about what to do next. Okay, now I'm home. How do I get everything started? So that's one of the real benefits of us being able to go into their homes, because most of the time they're not ready to come out in the environment. It's just going to be too much for them to get dressed and ready in the car, out of the car. So it's really good for us to see them in their own environment, try to give them things that they can work with at home to progress their function.
Laura Williams is another Court physical therapist and also participates in the outreach program.
Just trying to, recover from the surgery, but also kind of work on things that they need to work on to help progress them. But I think it really kind of hopefully helps kind of calm people's fears a little bit, so they don't have to feel like, oh, I've got to go into this gym environment and do all these exercises. But if somebody can come to my home, I'm more comfortable here, and I'm probably going to recover better that way.
The outreach program not only provides the patient with the early physical therapy that they need, it also evaluates the house for unique challenges, understanding what the patients will be experiencing on a daily basis throughout their recovery.
The biggest thing is for me to just go in and almost think that the patient isn't aware of anything. So I try to go step by step. What's going to be safe for you? What's going to be safe when you get in and out of the bed? Walking to from the bathroom in the middle of the night. So different things like that. We want to make sure that they're fully aware, because sometimes we assume that they may be knowledgeable about certain things, but that's not always the case. And just little things like turning on the light or a night light during the night when they're ambulating, getting up to the bathroom, or securing their toilet. So the biggest thing is for me to just go in and almost almost think that the patient isn't aware of anything. So I try to go step by step. What's going to be safe for you? What's going to be safe when you get in and out of the bed, walking to from the bathroom in the middle of the night. So different things like that, we want to make sure that they're fully aware, because sometimes we assume that they may be knowledgeable about certain things, but that's not always the case. And just little things like turning on the light or a night light during the night when they're ambulating, getting up to the bathroom, securing their toilet next to the bed, the potty chair, things like that can make a huge difference as far as patient safety, you know, especially when they get up the first few times, because they're so unaware of what's going to happen with their joint.
The keys are to promote recovery and safety. Some easy tips for you are to clear walkways of tripping hazards, use assistance devices that are indicated, and avoiding one of the most common pitfalls that land people in the emergency room, turning on the lights when walking around at night, especially when making your way to the restroom or bedside commode. Whitney notes that it is this attention, education, and assistance that promotes recovery and patients' value.
The patient really appreciates us understanding, you know, this is my challenge, these are my challenges, and we strive to get those patients more comfortable, feel more secure and confident in what they're trying to do.
As an emergency physician, I feel that physical therapy is one of the most underutilized tools for the recovery from injuries and painful conditions. Whether it's after a major surgery, a work-related injury, or the exacerbation of chronic painful conditions, physical therapy can help get you back on your feet, increase mobility, and promote future health and wellness.